Yet another breakthrough procedure Dr. Alan-Wu specializes in is vaginal rejuvenation. He explains how it works.
The inner layer of the vaginal canal is comprised of a type of tissue that's almost like plywood. It's called the endopelvic fascia. And when it's been traumatized or stretched out too much from a very large birth or perhaps a very large episiotomy, that lining becomes very weak. And a lot of women will report or claim that they feel less sensation during intercourse and actually feel that the area is very weak and loose. With vaginal rejuvenation, the recovery time can take as long as 6 to 8 weeks, but that sensation women usually report immediately on their first time of intercourse, and the sensation that it's almost virginal and a lot tighter than previous. Now, we do take a lot of other issues into consideration here. It is very important not to over-tighten the vaginal canal or to over-augment the G-spot, because there is the risk of causing overstimulation and too tight of a sensation and then leading to a problem called vaginismus. And that is why this type of surgery is not just taking something and making it tighter. It is also doing the art of deciding what looks good and what is also going to be functional for a woman in the long run.
I also had vaginal rejuvenation procedure done. I had both of my children vaginally, and both times I underwent episiotomies, extensive episiotomies, which left me sometimes having, diminished feeling in the vaginal area, and sometimes just a feeling of things weren't as snug as they used to be, and I figured might as well get everything fixed all at the same time in one simple procedure.
Sometimes the relaxed tissue of the pelvis and the vaginal lining needs to be tightened in order to be able to obtain normal sexual function in addition to normal urinary and bowel function. The procedures are G-spot enhancement, rectocele repair, and vaginal rejuvenation.
Well, my first visit to see Dr. Wu was, gosh, how do you say, just incredible. Dr. Wu instills confidence in me as a woman that I'm safe and secure in his hands, that he knows what he's doing. Dr. Wu made me feel comfortable with him, with the procedures. Dr. Wu put it into layman terms that I could understand, and instilled the confidence that I needed to be here, do it, and take care of it.
It is actually quite common for women to experience these kind of problems like a rectocele or weakening of the pelvic muscles. When you consider the fact that 13% of women after their first childbirth will have some sort of incontinence issue, and also 30% of those women will have permanent and irrevocable damage to their muscle and pelvic lining structures after their first birth, it tells you just how common this problem actually is. But because of the increasing population that are menopausal and postmenopausal and having weakening tissue and lining of the pelvis, and because there are more women that are demanding repair of their pelvis in order to have normal sexual function, this procedure is actually increasing very rapidly in popularity. We do these procedures here at the Morrow Institute on an outpatient basis under either local or general anesthesia, and these are procedures with minimal downtime and with minimal pain involved. The procedure of vaginal rejuvenation is something that can be done with both a laser or with any standard surgical technique.